Okay, thank you for your patience. So, yes, my name's Nelly Oelke. I'm with the School of Nursing at UBC Okanagan, as well as I work for the Rural Coordination Center of BC as well. And I'm joined today by Anurag Singh, who is with the UBC Northern Medical Program, working in Prince George and other northern communities, and as well Linda Helm, who's a community member who's been involved in this study, who's from Tumbler Ridge. And so I just would like to take a moment to acknowledge the tragedy that Tumbler Ridge has experienced, and how that has impacted the community. It has impacted all community members, families, parents, and the school staff and teachers as well. And I would like to take a moment of silence just to acknowledge that and to remember those who were lost, as well as those who are continuing to mitigate that and work through that tragedy. So thank you for allowing us to do that and taking that time to acknowledge that. So we respectfully acknowledge that this conference is taking place on the unceded traditional and shared territories of the Musqueam, Squamish, and Tsleil-Waututh Nations, and that we acknowledge that we are joining you from a number of areas of BC and beyond. Linda's actually joining from South Africa, and that this work is taking place on the lands of various First Nations and Métis communities in BC. I'm going to turn it over to Linda.
Hello, thank you for giving me the opportunity to be with you today. My name is Linda Helm, and I'm a community member of Tumbler Ridge. I've lived in that beautiful rural and remote community for the past 33 years. Our population is about 2,400 people. Thus, most of us are connected in one way or the other, making us into more of a large extended family than just a town. Together, we have faced a number of challenges through the years, ranging from forest fires, evacuations, mine closures, and most recently, the mass school shooting. We are now experiencing the problem of retaining and attracting family physicians. Some of the difficulties we can experience now are long wait lists to see a family doctor. And in the last 6 months, Northern Health has taken away all of our after-hour and weekend emergency department hours. This has left the people in town feeling vulnerable and anxious as to whether they will be able to access healthcare in our community when needed. So, when the hybrid care research team approached Tumbler Ridge to see if we'd be interested in being part of a pilot research project of how to best implement hybrid care in a small and rural and remote community, we thought the timing cannot get better. Through community engagement, we are hopeful that this research will bring and produce a tailor-made hybrid care program for Tumbler Ridge. With the collaboration we have with the research team and addressing the unique complexities of delivering quality, timely care in smaller remote communities, we hope a hybrid care approach may be able to bridge some of the gaps that we are facing in healthcare in our community. Our hope is for a hybrid care model to be able to provide the best of longitudinal care and both in-person and virtual care with both in-person and virtual care providers who know our community and our population. Thank you.
Thank you, Linda. Turn it over to Anurag.
Thank you, Linda. That was wonderful for sharing the story and the context. So I'm just going to build on what Linda just shared about her lived experience and how and what has happened in Tumbler Ridge. Just getting into what is hybrid care. As you can see in the illustration, it's a combination of digital virtual care and the presence in the community, which is in-person services. That's the hybrid element. But this is not about technology. And why is it important now as we are seeing that since the pandemic, virtual care has become standard of care almost everywhere. And it's considered to be, very positive, promoting equity and access, which is great, like we are connecting today. But we know in healthcare and relationships are foundational. The relational foundation is what matters most, and relationships between patients and their providers and between providers themselves are really important to really to the outcomes. So hybrid care supports a longitudinal, team-based, interdisciplinary model where care isn't just fragmented across disconnected encounters. So that is the idea behind it. And this isn't theoretical. Hybrid care has been implemented by organizations in BC like Kirisakani Family Services, First Nations Health Authority, and Rural Coordination Centre of BC through their RTVS pathways and programs. Next slide. So leading up to, why does hybrid care matter? So much of us is in the context. It is particularly valuable for rural, remote, and Indigenous communities where geography, workforce shortages, and access barriers make the traditional models insufficient. So we need a virtual element, but at the same time has to be embedded within the community. We've already been successful implementing hybrid care in several First Nations communities in northern BC, and importantly, these models were developed through genuine community partnership grounded in collaboration, empathy, and cultural safety. However, there is a key gap our work aims to address through this research project. This is almost like a program of work. We have been fortunate to be funded through the Collaborating and Convening Grant through Health Research BC, through seed grants from RCC BC and others, and also a team grant that we're currently year one into from the CIHR. So this work is ongoing and almost we're year one into that work. So there is limited research to guide how community-specific and cultural-specific factors can be woven into the current and future hybrid care initiatives. And there is a space, this is the space where we're working on. Next slide. Thanks, Nelly. So what's the problem we're trying to solve? So the specific problems driving this work are, first, we need to improve and standardize how virtual care is delivered. Right now, as it is, it's fragmented and it's inconsistent. Second, we need to fill service gaps and support a health workforce that is stretched thin in a lot of these communities or non-existing, as we've heard. Third, there are real quality of care concerns that need solutions, so we need to develop those innovation solutions. Fourth, and Linda spoke to this, continuity of care and sustained relationships with providers is essential. People shouldn't have to retell their story every visit and see their providers on an app who they don't know. And finally, we need to embed community voice and cultural safety directly into how healthcare is designed, not as an afterthought, but from the grounds up. Okay, so I'm going to hand over to you, Nelly. Thank you.
Great. Thank you. So this is the title of the research study. So planning and team building for hybrid care research collaborative to integrate research and innovation into virtual health delivery models for rural, remote, and Indigenous communities. And there are three years to the study. The first year is exploration with community engagement and baseline data collection. And so we've done 2 community visits, Takla First Nation and Tumbler Ridge, to this point in time. And we're also collecting surveys and interview data. Year 2 is ongoing data collection and economic analysis. And so looking at, again, surveys, interviews, and or talking circles, and then the economic analysis, and then looking at community report back about the ongoing learnings. And then year 3 is community report back event, community feedback and interpretation of findings, and the development of a hybrid care toolkit, and looking at policy change through a variety of different ways. And throughout this is all around continuous engagement with the community. And so we're reporting on year 1 activities and data that we have. So we used an appreciative inquiry, which has different areas like discovery, design, as well as, I should know this for sure. They're coming up. I'll get to those. So discovery was the first one that we looked at. So we asked people to reflect on your experiences with delivering or supporting healthcare in your community, including examples of when things went well. And so these are the 2 questions that we asked. What tools, processes, or relationships have supported your ability to care for patients effectively? And where have you seen hybrid or virtual care already making a positive difference for both patients and the workforce? So then we had a dream phase, a design, and a delivery. And these were the different questions that we used for each of those table discussions. And so dream is really looking at what's possible. Design then looks at, so what did we discover and what did we talk about in dream, and how can we design something? How do we make it real? And then lastly, looking at delivery and how do we move forward together? Hand it back to you, Anurag.
Thank you, Nelly. So what our community is telling us, and this is very preliminary. So our engagement sessions have surfaced several powerful themes. One of the themes is the communities want to be true partners in co-designing service delivery, research, and innovation, not just consulted. They want to be part of this from the beginning. And that came on repeatedly as a theme in our Indigenous community and in Tumbler Ridge. They see hybrid care as something that could be built into the infrastructure, not as an add-on to what is existing. There is a clear call to embed community voice structurally at systems level and decision-making level. That is very important. We also heard that people want they want standardization of how virtual care is delivered. That was part of one of our aims, but not at the expense of local context. Context is really important and central. The user must stay at the center of it. and should be designed as a wraparound around the need, even the standardization part. The communities also want input into who provides care, and that stood out especially from our Indigenous community. They want to vet the providers and be involved in the recruitment selection of the providers, and that could include nurses, physicians, allied health staff, and so on. There's also a strong emphasis on prevention and upstream approaches. We also heard that we look at data when people have medical conditions and the poor outcomes they have afterwards. There's a lot of interest in working upstream in prevention strategies and integrating traditional medicine and healing and established a formal community health committees to sustain this work. These results are preliminary, but they're giving us a very clear direction here. So I'm going to hand over to Linda.
Thank you, Anurag. In conclusion, hybrid care is an important area to focus on for rural and remote communities. Community engagement is an essential part in moving this forward and co-creating solutions. The community voice is critical as solutions are designed and delivered. The importance of longitudinal hybrid care needs to be recognized, while the best of in-person care and virtual care are blended in small, rural, and remote communities.
Thank you. We're going to open it up to questions, and I'm just going to stop sharing here as well.
Thanks so much, Nelly, Anurag, and Linda for that amazing presentation. It was interesting because I was writing down questions and the next slide was answering my questions, and I was giggling because I'm like, oh my goodness gracious, I'm going to have to think outside the box here. But I welcome and open it. If anyone has questions, feel free to come off mute, or you can write into the chat, or you can raise your hand, whatever you are most comfortable with. I see that we have quite a few folks in our room, so I'm going to give pause.
I think one thing to share, this work really highlights some of the challenges in rural health infrastructure and rural research. So the communities we partner with are evolving and things happen as we are working with them. So we've learned a lot from Tumbler Ridge and what has happened in Tumbler Ridge from them, and of course Linda as our partner.
I see a hand up on Leah's side. Yes, go for it.
Hi, thanks so much for such an amazing project. It's really an exciting field for sure. The potential of digital care in rural and remote communities. I was just wondering if you could provide maybe a little bit of information more about the location itself. So I was really wondering maybe some of the specific challenges that might exist in Tumbler Ridge that have to be, the hurdles that have to be overcome for actually leaning into a model of hybrid care like this, specifically around things like digital literacy for older adults in rural areas, as well as the connectivity actual issues to be able to allow for this kind of system to be robust and reliable. And the last part really is, as I'm really interested on a personal sense from my own research around maybe some of the informal systems. Maybe Linda can speak to this, I'm not sure, but informal systems like senior centers that might be helping older adults to support older adults in this. I think in rural remote communities, it's that community piece that seems to pave the way for something like this to actually take root.
If I can answer the piece in regard to the seniors, we have a very strong senior community group, and they organize and they support each other and are very active in wanting to know what they can do to improve their health care by how to take care of themselves and becoming more knowledgeable. And also as he said, seniors are not all very literate with technology, but at the same time, many of them are. So there is a group already in place who would be jumping on board to help out. And in Tumbler Ridge, what I can say is that it's not just the seniors. We work together as a family, so we'd be there to support each other in any of these areas where we'd see there'd be needs. We could find people.
I'll address the first part of the question, and then Anurag can follow up. I think one of the biggest concerns for Tumbler Ridge, for Takla First Nation, for many rural, remote communities, is the lack of care providers and the consistency of care providers. And so sometimes you'll have someone come in, but then they don't know you, they don't know the patient, they may not have access to the record, and all of those things. And I think that's probably one of the biggest concerns. The second major concern is emergency services and coverage. And that's very much the case in Tumbler Ridge, but it is the case in the other in Takla as well, and the case in many communities. I just attended a conference on Friday and Saturday last week on transport, emergency medical transport, and I think there's a desire to do more and do better. But we need to be innovative and work together to be able to address those issues. Anurag.
Yes, so thank you. You raised several points. There is diversity in communities. We see differences in terms of, health literacy, and it's kind of sometimes historical. Some things have evolved over time, as in loss of services. Particularly in Tumbler Ridge, they used to have services which they've lost more recently, and then the impact of this recent tragedy. So the main idea is to kind of create a standard of care that these communities deserve, which cannot be just an app or a name. It has to be a human who has the ability to form relationships with the members who are seeking care. I think that's the whole concept. We want to humanize the virtual digital part of providing care, because we can see the equity gap here, that over time, as we're trying to develop more digital, AI type tools, a lot of communities like Tumbler Ridge will have no choice but to only go to a bot and talk about their medical problems, right? So that's where we're trying to seek the value, and we see increasingly we're seeing the need for sure. There are some services that exist and will need support, like in Takla, First Nations. There are little groups which are already having sort of ideas, and they're promoting health and walking groups and how to go grocery shopping. So the issue first, of course, is emergent urgent care, like Nelly was saying, but I'm also interested in longitudinal chronic disease management, because a lot of time the lack of emergency gets more media attention, but at the same time the lack of longitudinal chronic disease management, like for diabetes, hypertension, kidney disease, which I practice, the outcomes are devastating. You just don't see it in that moment. And I think investing in a standard of care or a model at this point for the communities is very important. So yes, so we haven't particularly explored older adults, but it is an important area that comes up repeatedly, because there is an element of digital literacy, at the same time digital divide. It depends a lot, reliability on the supports within the community. But I think the personal connection to the provider and the knowledge the provider has because of that relationship is very, very key. So I know patients who I've met, who I care for. When I get a phone call about an event, I'm in a much better place to advise or give recommendations to what to do compared to if I was meeting them for the first time or I just had a message about them and I knew nothing about them. So I think that knowledge for the provider, that relationship is very key to direct care. So yes, sorry, I hope this was not a ramble in addressing some of your questions.
That was really great. Thank you so much. Really appreciate it.
Okay.
Open floor if anybody else has any questions. We have 4 more minutes. We have some time. I have to admit, I'm trying really hard in my professional life to have pause. For those that know me, I like to talk. That's part of my job, and so I'm trying really hard to keep myself quiet for a moment and allow space.
Yes, if you're just thinking, the group we have is very large and interdisciplinary. We've organized ourselves into what we call as the Hybrid Care Research Collaborative. And citizens, community members, including Linda, are part of that group. There are about 32 of us. And they include, health providers, physicians, nurses, physio, OT, community members, health system leaders, and others who are decision makers. So we're following a framework to really advance this work forward, hopefully to a stage where we can influence policy. So that's the idea, and feel free to email us. Hopefully soon we will have a website and you can message or connect that way too. So it's Hybrid Care Research Collaborative. And yes, anything else, Nelly?
I don't think so. No.
Okay. And patients definitely come first.
Yes.
Well, and on
I'll just
that, oh, sorry, please go ahead.
Oh, I'm just putting the Hybrid Research Collaborative, the name in the chat. And so, yes, do keep your eyes open, and hopefully we will have a website soon.
So wonderful. And I wanted to kind of full circle it back. Linda, you said something that stays with me, learning what I've learned about rural and remote communities and how each one is so unique. And at the beginning, you had said care that knows our population. And I think that is such an important final end note that I'm taking away from this, is that each community is so different, but might have commonalities, but unique. Each one is unique. And so I wanted to full circle, Linda, that your words sat with me most, and I'm so appreciative of the learnings today. And thank you to Nelly, Anurag, and Linda. Linda, would you like to close out with anything else?
Thank you. I'm very grateful that the Hybrid Care Collaborative research team is doing this important work. I think it will revolutionize the care that we can receive, and the quality care that can come out of it for small places like us in Tumbler Ridge, Tackle Landing, and many other communities. It's very exciting. It's a large group of people coming together under great leadership. Thank you.
Thanks so much. Thanks so much to everyone for joining and for presenting.
Thank you.
And appreciate all of your time. And please feel free to reconnect through the Whova app if you want to continue the conversations. All the best. Take care.
Thank you.
Thanks.
Thank you. Bye-bye.
Thanks so much, Linda. I just want to, yes, go to bed.
No, thank you. Thank you. The thanks is to you guys, honestly.
Okay. Take care. Say hi to
Okay, have a
Charles.
wonderful day. Oh, well,
Yeah.
he's asleep. Yep.
Okay. All right.
Bye-bye.
Bye.
Thank you.